How's it going? This is the Next Level podcast. Today we have a special guest all the way from Montclair, Dr. David Kim. He might look like my brother, but he is not. We get that a lot. So Dr. David Kim is the lead physical therapist over at Adapt Physical Therapy in Montclair, New Jersey. Welcome.
Thanks for having me. First time doing a podcast.
So, the topic for today is the topic of chronic pain and what we do in terms of physical therapy to address chronic pain. I mean, I've seen many chronic pain patients. You've seen many chronic pain patients, but do you even like that term, chronic pain?
Honestly, I don't. I think they're just humans, and we just have to respect that. Oftentimes, we slap a label, chronic pain on people, and it just seems so complex. But again, they're human. First off, we have to meet them where they are. And there's just so many factors to consider. We are movement specialists, but we have to consider, like, how are they managing stress? How is their nutrition? How's their hydration? What are their interactions like outside of PT? What's their family life? What's their social life like? All of these factors play a role into, how somebody could present from a pain perspective. So we do have to respect all of that. The human body is comprised of many complex systems that work together. So we have to figure out what the emergent behavior is and go from there.
Yeah, I think another thing is that, slapping a label on somebody and saying that they're a chronic pain patient kind of denotes that they don't have any hope, right? Like this person is their identity is pain, right? And they've had it for a long time.
Mm-hmm.
So how do you go about addressing someone of that mindset and how to get them out of it?
Yeah, so usually when people come to see me, they are broken. They've been, crossed off from multiple medical providers. And, one of the biggest things I preach to them is, your body's resilient, meaning, your body is not fragile. It has a capacity to heal. You just got to give it the right stuff, right? Like, we often try to focus really hard on the movement stuff, but we got to get our basics right first. So stress management, like I said before, hydration, nutrition. If we get those little elementary, blocks correct, then we could focus on all the movement patterns and, see what position their body is in and, tackle it from there. But essentially, it's easy to feel broken when you've been through it all. When you've been to PT before, when you've been to a chiropractor before, and they do the same stuff, there's no customization, there's no one-on-one care. If they don't even watch you doing the exercise, like, how do they know they're getting the right changes from what they're giving you? So that's some of the things we tend to focus on at, both Adapt and Next Level. We individualize everything, we customize everything, and we have to. And I know I'm going on a tangent here, but
it's okay.
First podcast, sorry.
No, I think that's really important. I mean, I think what we are providing is hope, right? And especially with those people that are in chronic pain, that a lot of them don't have any hope that they can get better. They don't have any hope that they can find somebody that can help them. And also, it's understood that there's no quick fix, right?
Right.
And any of the patients that I've had in the past that have been in chronic pain, they need to know that they have to put a lot of work into it too. That there's no such thing as a magic bullet. There's no such thing as the fountain of youth and a quick fix. So I think that's really important when it comes to individualized care. If you're in chronic pain and you do not have more than 5 minutes with your PT or 10 minutes with your PT, there's the chances of you getting better there are probably very slim. And I think that's something that you and I we've talked about before, that A lot of the differences in terms of their plan of care is just attention,
Absolutely.
attention to detail, and
Yeah.
attention to what their body is feeling, how they need to move, what their body isn't doing right, and what their body can do right, and really building that resilience there.
Absolutely. The way I view it, you get into pain actively, so you have to get out of pain actively. And that's something I preach with every person who walks through the door. There is no quick fix if you want to get to the root cause or causes. Obviously, as a provider, you have to, rule out the red flags, right? There are always systems in place. So sometimes it could be, it could not be the movement system. It could be something cardiac, could be vestibular. Either way, we have to rule those things out first. And then from a movement perspective, we have to identify what position your body is in. And I sound like a broken record, but you know, here's an example. If I have 5 people in front of me and I have them squat, everyone's squat's going to look different, right? Some people might cave in their knees. Some people might, hip shift, to the right. They might lean to the left. You see all sorts of funky stuff. The question is why, though, right? Like, why is that happening? And so, as a movement professional, you have to identify what the causes are, what the body is doing that's forcing that to happen. And then from there, you got to intervene. Conveniently, I have a little pelvis model here. So we know from a medical perspective, this doesn't really move much, but for educational purposes, I'm going to exaggerate a little bit. So let's say one side of the hip is slightly more forward or it's angled a certain way. That's going to have repercussions on how somebody moves. And when you do see someone in pain, you have to consider not just that joint, that side of pain, but you got to look at the whole thing from head to toe, because everything tells a story. So, we always like to say, like, we check the whole body, but as providers, do we really do that? Right? Like, do we, if it's a hip issue, do we also look at the knee, and do we also look at the shoulder? But what about the other side then? So one of the things that we, do at Next Level or Adapt is we look at the whole entire system. And that's the only way you're going to address pain.
Yeah, I think there's so much variability in the way people present. In a lot of ways, they present the same, right? They're just people trying to live life, right? They're trying to pick up their kids. They're trying to do the same stuff that they were able to do 20 years ago, and then it's the small differences in their presentation. It's the small differences in what they're saying in terms of their kind of daily life that makes all the difference. And I think that especially what you're talking about is important for the general population to understand. I mean, we're not talking to a bunch of clinicians here necessarily, but what we see from patient to patient is that there's a lot of differences between people, but there's a lot of things that are the same as well. And if we're able to kind of teach patients the right things, and we are able to teach clients how to move better and restore range of motion and teach them how to get stronger again without being afraid of hurting themselves. It's very simple at the end, right? We're just trying to get people to move and not be afraid to move,
right,
and be resilient, like we were talking about before.
Absolutely. We want them to move with quality movement versus just moving for the sake of moving, although that is beneficial. You have to move, and I'll pick movement over not moving any day. But, one thing I like to say is better, more is not better always. And yeah, we definitely, when it comes to the chronic pain population, you have to meet them where they are. They all have different learning styles. So if you're a provider and your background is CrossFit, or your background is powerlifting, or your background is yoga, right? You're going to be very tempted to essentially give your exercise style to the patient, but you have to consider where they're coming from, their training history, their learning behaviors. Are they visual learners? Are they Do they do better when you hold their hand and you go over one or two exercises, but do it correctly? Or do they do better when you throw the farm at them and they're like, yeah, I love this. This is, what I'm about. So you have to really tailor it to that person, even to that level. And that's where, people might get frustrated with working with chronic pain people, but at the end of the day, they're human, right? If you were in pain, you would probably expect the same thing. And that's all we're trying to do here.
Yeah, I mean, I think that the most important thing is that um, we understand where the patient is coming from and we understand where they want to go, right? And especially with patients that have been in chronic pain, they think that they're only capable of this, right? And really kind of busting through that ceiling and showing them that it is possible for them to get back to some of the stuff that they weren't able to do.
Absolutely. Like all the patients who come to me initially, I'm like, oh, what's your goal? And they're like, get out of pain. I'm like, give me more. And they're like, no, it's really just to get out of pain. And one thing I have to always, express to them is once you get out of pain or once you start to feel the symptoms go away, your goals change because you realize, oh, like I'm capable of doing more. It's almost as if they're in pain for so long, like they just forget what they're capable of.
Yeah.
And they just think that they're stuck like that forever. Mm-hmm. But you can absolutely take, action, find a PT who can, rule things out appropriately, take a look at your whole body as a whole, and then give you the right interventions, and also somebody who will actually recheck after doing their interventions. Because oftentimes, a lot of PTs will prescribe things, but if they don't check it, how do you know it's working for you? Right. So find somebody who could do that. And then from there, possibilities are endless. Your goals will constantly change. And that's what happens for our patients.
Yeah, I mean, I think that especially with, I mean, we here in at Next Level in Cliff Lake, we treat a lot of patients that are very active, right? There might be triathletes, they might be people that want to run marathons, they could be CrossFitters. But if they are in chronic pain and they have been for so long and they are unable to do the things that bring them joy, there's a lot of baggage that comes along with that. Depression, anxiety, feelings of inadequacy.
Yeah, or like guilt, even.
Yeah, absolutely.
And like it affects their relationships with not just their partners, but with their children, with their friends. I hear all the time like people don't feel social anymore. Mm-hmm. Granted, it's still the pandemic, but when you're in pain, it's like your identity is getting stripped from you. And if you are out there feeling that way, I want you to know that your body is super resilient and you are capable of healing. You just gotta, have that switch in mindset and find a provider who will actually take the time to listen to you. Because your story matters. One thing I tell my patients all the time is, I know the body better than you, but you know your body better than me. So it's going to have to be a team effort always, constant communication. Like if you've ever gone to a provider and you tell them, hey, I'm feeling this, and they just make you feel like you're crazy, that's not good communication right there. That's not teamwork. If anything, they're just writing you off and just making you feel like you're not resilient. Mm-hmm. And that's the opposite,
Yeah, I mean, I can't tell you how many times I've had a patient come in. They have an MRI in their hand and they says, there's just so many things wrong with me. I'm completely broken. I have 4 herniated discs and I have this and I got arthritis here and I got, all these problems. And a lot of times they come in with that MRI and they show me and it's almost like they're saying, this is why I'm broken and this is why you can't fix me. Mm-hmm. And getting the patients out of that mentality that they're never going to get better because there's something structurally wrong with you, is, I mean, it's a tough hole to dig out of as a clinician, as somebody that wants to help. When somebody comes in with that mindset that they can't be fixed, they're broken forever, there's something structurally wrong with them, and all they want is to be a little bit in less pain. I think that mindset is a dark place to be. But I think it's super important for clinicians like us, or providers like us, to get to that kind of root. What is actually hindering them from actively seeking and actively understanding that they are not fundamentally broken.
Yeah, I mean, even for me, I've herniated my discs before, and I'm back to doing what I love, right? Like in the moment it sucks and you might feel broken and you see the image and it shows you, hey, you herniated your discs. If you were to take an image of my back now, you would probably see something. But I'm not in pain. And for those of you who are, have a herniated discs, there will come a time where, it's not as bad. And there are certain positions or activities that make it feel better. Did that necessarily change anything structurally? No. You're just moving in positions that are conducive to healing, right? So you want to make sure that the environment in which is affected is conducive to healing and you're not irritating it constantly. Like if you sit on a pebble and you don't get off, it'll first start off as a bruise. It hurts. And then if you really don't get off, you'll get an ulcer. So you have to find the right movement for your body. And so if you are out there and you are in pain and you feel like the world's over, the world's ending, fear not, like it's not. We are here for you, and just find a provider who will take a look at you as a whole, listen to your story. We've been there in terms of pain. Dave's had surgery before. I've had a herniated discs or many discs, and I thought my life was over, but here I am talking to you guys.
Yeah, I mean, I thought my life was over, and then, I massively herniated two discs in my back, and I went through 2 years of pain, and eventually I had to get surgery, and that's okay. Sometimes that is the path you have to take. But I'll tell you right now, I've done my rehab. I've done all the leg work and the hard work that went into rehabbing from my injuries and from the surgery, and I'm 110% now. I'm actually probably in better shape now than I was prior to my surgery. So, if you're out there and you have had these herniated discs and you've had surgery and you have arthritis, and you're not the only one that's had that story. And although you are a unique and special person, what you're going through is not unique, and it is something that we can handle and we can deal with. But yeah, I mean, I think that we both have had similar experiences and have treated a bunch of patients and have gotten a lot of people a lot better. But it really takes a team effort and a lot of communication, a lot of listening, a lot of hard work. Mm-hmm. And I think that's also part that people leave out. They think that, you go into rehab and just get a massage and a hot pack and some stim and you'll get better. It's not the way it works.
Yep. You nailed it. Absolutely. You got to put forth the effort. You will be guided, but you have to put forth the effort. Yeah. It's your body and you have to get out of pain actively.
Yeah. I mean, that's a nice little tagline there.
Yeah. Get out of pain actively.
Anyway, so thank you for tuning into the Next Level podcast. Thank you, Dr. Dave.
Thanks for having me.
We're going to probably have you on in the future again, and we'll talk about some other stuff.
Cool.
Maybe some powerlifting stuff, maybe
some I like to eat stuff. Sure, whatever I'm down.
Awesome. Have a good one, guys.
Bye.